ninth session of care. Thank you all for joining us today. Today we are going to discuss on the on one of the important part in palliative care, that is caring for people with disabilities. We do have an NL faculty joined us. It's our privilege to invite you, Miss Ashla Rani. Thank you, ma'am, for being here with us. And we have our facilitator, Ms. Shilpa Johnson, joined us here. Shilpa is the Junior Social Officer in Pallium, India. Welcome, Shilpa. And for further session facilitation and faculty introduction, I invite Shilpa. Over to you, Shilpa.
Thank you, Senior, for the kind introduction. A very good afternoon to all. And today we are on 9th session of FCPC, and the topic is caring for people with disability. And I'm extremely happy to invite our faculty, Ms. Ashla Rani, a trustee and a volunteer of Pallium India. Ashla Rani had come to Pallium India as a care receiver in 2014, become a full-timer volunteer, and now both a care recipient and a care provider. She works with people with disabilities and also acts as a counselor for the children whose families have been devastated by serious illness. Ashla Rani has won the International Award for Excellence in Palliative Care 2021 in the volunteers category, and this is an annual award instituted by Career Cancer Aid Society USA for SAR countries. She won Kerala's Government Youth Icon Award in 2017. In the same year, she was also the state award for the most efficient employee in non-governmental sector. So I'm extremely happy to invite you, ma'am, and welcome you, ma'am, and over to you.
Thank you, Shilpa and Senior. Hope I'm audible.
Yes, Stacey, you are audible.
So, the first face I saw was Ajay first, and then I was thinking, oh my God, he'll be bored to death because I'm telling my story for maybe, I don't know, like how many times he had heard my story. Sorry, sir, about this. I don't think we'll be talking anything new which you don't know today, but maybe for the benefit of others, we will discuss some points. So, okay, so we have some 49 people, 48 other people over here. So, if you can raise your hands if you have any direct experience caring with or being with somebody with a disability. Any of you in this room? Okay. Geeta
Right
ma'am.
now, not maybe right now, maybe after I think a half decade back or so, my grandfather used to be there, and so he lived up to 99 years.
Okay.
So the thing is that in the last few years of his sojourn, during his last phase, so he was a disabled person. So he's a handicapped, and because managing his day-to-day course was really challenging in terms of his activities of daily living as well as his food, eating, everything. But thing is that fortunately, I mean, the people around him could take very well. But thing is that we really don't know the suffering. I mean, how to address his pain, because even though the treatment was given, but not. I feel, because now when right now I'm a psychologist, I feel that it is not adequate enough. But the comfort and the warmth that is given by us is enough. But whereas that in terms of treatment, I think the palliative care was not sufficiently done. I feel that. That's it. I want to share.
Okay. Thank you, Ravikant. Anyone else? Okay, I think I saw some other hands going up. If you want to just share, you can unmute and then share.
Madam, previously I was with the halfway home here at Pallium, India, and I have met so many people. I was very much surprised to hear the sad stories. Not they don't want any sympathy, but empathy. I surprised to hear one thing: their sexual sexual disability. How to address the sexual disability was a problem to Pali India also. Then Pali India set up a questionnaire and distribute them to know their actual needs. That was a great experience to me. That's all. Thank you.
Okay. Thank you, sir. Anybody else would like to talk? Okay. I just wanted to understand, okay, how many of us like have some kind of an experience living with or caring for people with disabilities, so that because that brings up a lot of realities upfront, because when we see somebody on a wheelchair or some people with disabilities outside the, like maybe in your workplace or when in your hospital or wherever it is, what you see may be only the tip of the iceberg, but what it is to actually live with a disability and what it is to be a caregiver on a day-to-day basis, a caregiver for a person with disability may be so different from what we see somebody with a disability using a wheelchair or using a white cane or communicating in sign language or whatever it is for some time, maybe for 5 minutes or 10 minutes at some point of time. So that will be very different from what we actually experience at home 24/7, being somebody with a disability and being somebody caring for that person with a disability. So that's why I just asked to understand who has got that kind of an experience here. So I'll just start with my story, because I am not a medical professional. The only palliative care knowledge I have got is what I learned after coming to Pallium India. And my experience on disabilities also, my living experience with disability. So I have not learned anything outside of that. So I just wanted to share my story first and then go to some slides wherein we talk about some definitions and facts about disability in the world. So uh, I came to Pallium India in 2014. That was more than 8 years back. So I met with an accident 4 years back. So I was not 4 years back, 4 years before I came to Pallium India. So that was in 2010. So I was born and brought up in a rural village of Kannur, which is a part of northern district of Kerala. So I studied there and then I did my master's in computer applications, and I went to do my work. Like I got a job in an IT company in Chennai. So I was working in Chennai for almost 4 years. And that's when one day I came for holidays back home. And while I was returning, I met with an accident. I was traveling, one moment I was traveling in my train on the way to my work. And then the next moment I fell off that train. And when I got up, I was in a hospital bed. It was after 2 days or so after my accident. So that's what happened. So at one moment, I was like, okay, I have to reach to office Monday morning. I have a lot of work to complete. I had actually an internal audit to finish. So I was so worried about everything that was staying there. So I had to complete this work. I should do this. Everything should go well. And I somehow felt like, okay, I have something important to do. I'm an important person. I'm doing this. I'm living this life. So happy. And the next moment, when I got up in a hospital bed, I didn't have anything. It was like, okay, I don't know whether I had a name maybe on the records, but I was a case of spinal cord injury, a case of quadriplegia who was like recommended for a surgery, admitted in ICU. So what you have is like a couple of diagnoses and then the reports which are coming, and then what doctors are commenting on. And then I never knew what was happening with me because I didn't have any sensation. I was completely bedridden. I had broken one of my arms, one bone in that. So they were planning to put that in a cast, and they were planning to do a surgery to fix my vertebrae, which was broken. So it was, and I didn't know what was going on. People were talking about me, but not to me. So, and I was not conscious for 2 days. So after that, when I was asking, okay, where am I? What am I doing? So they said, okay, you're admitted in a hospital. So this is what is happening. You have your relatives waiting outside. So I knew that. And I saw them through the window when they open it for some 5 to 10 minutes every day in the morning and the evening. So that was my only connection with the outside world. So I knew there are some people waiting for me. And then it was a struggle for many years. So I got my surgery done, and then it was like I was told that okay, I should do the physiotherapy to sustain. Like I didn't know anything about spinal cord injury. I didn't know. My biology was very bad. I studied biology only till my 10th standard, and I said, from now on, I'm not going to study biology. So I switched to maths. So that's how my relationship with biology was. So I never knew what actually a spinal cord does, like in a human body. So, and I was learning that by experience at that time. So I didn't have any sensation. I couldn't move my legs and hands. So it was all, and I was, my bladder and bowel, both of them were incontinent. I couldn't control it anymore. I couldn't feel things anymore. So it was like I was learning, okay, this is what a spinal cord is doing, and I'm not able to get this out of it because I have a spinal cord injury. So I was learning everything by experience. So it was so much to take in at one point of time. So, but then it happened. So I did my surgery, and then after that, I was in the same hospital for till that post-operative review, just because I come from a very rural village, like far away place, and then mom did not have the confidence to take me back home and care for me for a month and then get me back for the review. So she decided that and along with my family decided that, okay, we will stay in the hospital for 1.5 months so that we can get discharged after the post-operative review. So I stayed in that hospital, got my physiotherapy, and then there they said, okay, what you can do is you can get good physiotherapy, and that's what is required for the spinal cord injury. So, and then we moved from different places, one place to another, based on the recommendation of people who knew about it, from where we heard about all these kind of facilities. So I went to Vellore for a rehabilitation center, Vellore Rehabilitation Center for around 2 months, and then came back and stayed in a uh, in a physiotherapy center for more than 3 years. So it was only because we couldn't go back home. There was no physiotherapy existing over there. And we couldn't think of going back home and staying at home without any facility, any access to healthcare, because the place I stayed, my home, that was around more than 200 meters from the road. And there was no road, like it was only a footpath towards my house. So if one fever would mean that people will have to carry me for more than 200 meters to the main, the tar road, and then put me in ambulance and take me to hospital, which was around 7-8 kilometers away. And even the regular catheter change every month, I was on indwelling catheter, and then the changing that every month would mean the same process. So she couldn't think of doing any of those at home. So we decided that, okay, maybe we will stay in a hospital. And luckily, like she had some money which was saved for my marriage that could be used for all these process. So we stayed in a hospital. So, and there at least I got what got the attention was my physical disability and issues. So I was getting the physiotherapy every day 2 times, and I'll be doing physiotherapy and then eating some food and resting and sleeping. So that was the schedule. I couldn't do it much on my own, and I had to learn everything from the scratch. Like, okay, learning how to write, how to sign, how to use my laptop. Luckily, I had some people who encouraged me to do it. I had a physiatrist who said, okay, you are a software engineer, so you have get back to your job at some point of time. So why don't you learn to use your laptop again? So I got one. I didn't have one. So I got a small one and I started like tapping on those keys to understand, okay, how to use it. How do I use the mouse pad? So it was all from morning till evening, learning new things. So even how to feed myself. My mom was feeding me for many months, and then at some point of time, I learned how to hold a spoon, how to feed myself, and how to have food. And that meant a lot to me at that point of time, because otherwise what happens is like we returned from physiotherapy around 12:45, 1 o'clock. We are both hungry, but my mom will have to wait to like for me to eat, and then she'll be eating. So that like thought that okay, she is also hungry just like me, but I'm eating and she'll have to wait. That was stressful for me. And then at one day when I learned that okay, I can do it, I practiced a lot. And then finally one day I could actually hold a spoon in my hand and like eat by myself. And it was like a okay, and now at least we both can sit together and eat. So that made a lot of difference in my life also, the way we were interacting, the quality of our life, because eating together and talking to each other is a different story than somebody feeding you. So that meant a lot to me. So every new learning was like that. So I used to celebrate, okay, how do I like sign it? So somehow I learned to like draw it again and again and again. And one day it came out like, okay, it's somewhat similar to what my sign used to be. And then finally I learned it. So it was all new learning for me, and also it was a difficult like journey to go through, because like there is no Ashla at all over there. So that was only in my mind that okay, I am a person and I had some experiences and I had a life which I lived fully and all. So nobody knew it. Everybody called me that patient in room number 3, that quadriplegic. And then, so it was all about my physiotherapy, and then about like, what do I do next? Like, what is the kind of exercises you need? Where do you focus on? Whether you focus on your fingers or whether you focus on your balance, sitting balance, and those kind of issues were always discussed, but it was never like, okay, Ashla, how are you? It is nothing about Ashla, and Ashla doesn't exist at all in those people's mind, because as a person, I am something different, and as a patient, it's an entirely different thing. Actually, in fact, in today morning, I was reading about, I don't know whether you have heard of, there is somebody called Chochino who talk a lot about dignity therapy. Harvey Chochino, if you can just Google about dignity therapy, his name will come up. So he was talking about, in an article, he was talking about why is it so difficult to be a patient. And then he was coming and saying that like, so when you are a person, you are so unique. You're not, there is nobody like you in this world. So you are that unique. But then when you are a patient, like the medical system, they have, okay, there is a diagnosis based on that, and based on so many other conditions and your test results, you like fall into a category. So that is what defines you uh, from now on. So, and he is talking about how we forget, why, like what kind of a person we are, and uh, like what we were doing before. what is important to us and all those kind of things. And that I could relate to that very much, because the one word which we lose first and foremost is dignity. The moment you have a disability or the moment you have a chronic illness, people don't talk about you don't have your dignity, you are not treated as a person anymore. So, and like that is why it is so difficult to be a patient, is what he was telling. And then I was so touched by what he is doing in dignity therapy. So he framed this personal dignity question, or some PDQ. That question is, what that says is like, it asks every person, what should I know about you as a person to treat you well? So that gives me a chance to say that, okay, my name is this, and then like I like reading, I love to go to work, and this was my dream. I wanted to be this person, so that you know about the person more than the spinal cord injury and my physical medicine and rehabilitation requirements. So that's what he is trying to do. And I was so touched by like reading that okay, there are things happening in medical field that which are very important for us. So that was something which I went through my life, and then which I could relate very much, because I was never existing as Ashla anymore in anybody's like life. So, and then it was 4 years, I stayed in a hospital, and after that mom was saying that we don't have any more money, we will have to go back home. So at that time I started thinking, okay, what do I do? Because I don't want to go home and stay at home. It would mean that, okay, I get up every day, maybe get my bath, sponge bath, no attached toilet and bathroom. So it will be a sponge bath, and then I'll be fed, I'll be loved. I'm sure my mom will do her best to care for me, but then that is all about it. I'll wait every day for my death, when it comes, when it is going to come. So I'll be bored to death, and I couldn't call it life. I thought it is just an existence. It would be an existence, but there is no life at all. So I didn't want to go home to that kind of a situation. So I was kind of searching, where do I go? What kind of a place would suit me? And I thought, I need a lot of help. For even today, I need to be here and sitting in front of you and talking. I need my mom to give me my bath and dress me up, and then give me food, and 2 people to shift me from bed to wheelchair. And all these are required even today. So this should be a place wherein I get all these kind of care, but still I'll be able to provide something back, give something back. So that was my only idea when I was thinking about what do I do, where do I do? Because when every day morning I'll get up, and then I have 2 lists. The one is list of things which I can't do, and the other one is list of things which I can do. And even after months and years of physiotherapy, the list of things which I can't do like was so long. But then I could add at least some things in the list of things which I could do. That is like using my laptop independently when somebody can place it in front of me, and then maybe read and write again. So those were some, and listening to some people when they have something to tell me. So those were a couple of things which I could do. I could smile at people, I could listen to them, I could be with them, and then maybe do things in my laptop, whatever is required in my laptop. So I was thinking, maybe with my skills, those kind of skills, I can go to an like old age care home wherein there are elderly people who love to read before, but then they can't do it because of their age and because of their eyesight or anything, any physical issues. But I can sit next to them and read to them newspaper or books, because I love reading too. Or I can go to a maybe special children's school or care homes wherein there will be paid caregivers who gives this kind of services. So I get the care which I need, and maybe I can teach them math or English, the basics which I can do. And then maybe I can help with their administrative work, whatever is possible through my laptop. So these were the random thoughts which I had, because there wasn't like much I could do. So I was thinking maybe I'll find this some like kind of place wherein I can go and stay. And one thing I was sure about was like, I don't want to go home. So then the search, some friends helped, some people I met on the way, they helped. And then that's how I learned about Pallium India. And then I came to Pallium India like 8 years back. So, and then when I came here, I learned that, okay, I learned what is palliative care. So I was understanding that, okay, there is a medical specialty called palliative care, which takes care of, treats suffering, looks at people like not as patient, but as persons. And then my mother will be also cared for. She was always a bystander till I came to Pallium India. So when I came to Pallium India, it was like, okay, people were asking, okay, what is your name? What do you do? What did you do before? And then what help do you need to care for Ashla? So things were like, okay, me and Amma were kind of one group, and then they were looking at us to truly understand what do we need to live day-to-day life and to be happy and to be productive and do things which we want to do. So that was the whole change in the shift in perception about, okay, what medical profession can do, how healthcare should be, and also. So I came here. So the last 8 years have been like great time for me, and I feel that, okay, this is the blessing which I got, because I could live the life which I want to. I can be productive here. I get all the help. My mom is also happy and healthy, because she gets the help which she needs to care for me. So this is like, okay, I'm living this life here, a productive and happy life. So I'm happy to be here in front of you also talking. Otherwise, if it was in my IT field, I wouldn't have met any of you. And so I also, what do I do is I work as Dr. Rajagopal's assistant, and with my living experience of disability, I try to tell people what it is to live with a disability and what do we need to do for people with disabilities and with people with disabilities to make the world a bit better. Because what happens is none of us none of us were taught about how to react to, or how to deal with, or how to interact with a person with disability. So we want to help, but we don't know how to do it, and we feel so helpless, and then we do something with all good intentions, but then in turn we hurt people. We want to make a conversation, but when we see somebody suffering on a wheelchair, or somebody who is sick for that matter also, and we don't know what to say, and then we ended up asking, what happened to you? And such a wrong question. So with all right intentions, these kind of things happen, and that is because we have never seen people with disabilities outside in the public places. We never got a chance to interact with those kind of people, and it's not our fault that we make mistakes sometimes with all right intentions. So I use any opportunity which I get to tell people that, okay, it is okay to have a conversation with people with disabilities, the way you have it with anybody else you meet for the first time. So those are some things which I try to do. So I have a small PPT here which shows some kind of a definition, etc. And we'll go to that and go through some slides where I try to talk about the etiquettes of disabilities and all. So is it visible?
Yes, Stacey, it is visible.
Okay, okay. Thank you. So here, this is actually a definition of disability adapted from a WHO definition. I removed some words because it was like too much on a slide. So I'll give you 10 seconds to read this. Okay, so the words which I want your attention on is like, okay, it's an disability is a broad term which is used in many different places and many different ways. But three things that comes at the core of it is, there is an impairment. Okay, so I have an issue. I cannot move my legs or my hands or my fingers. So that is an impairment. And because of that, there is an activity limitation. I cannot walk or I cannot use my fingers like you use and then do things with that. And then because of that, I'm not able to participate in issues or in life situations as you all do. So I cannot walk, so that I'm not able to go out and I'm not able to be in the public and in any public programs. So these are the three things which adds to your, which contributes to your disability. But the thing is, like, only when all these come together that it causes a disability. So I have an impairment, but if I have an environment where, if I have a wheelchair, and which I can like ride on my own, and I have an environment where it is accessible to wheelchair, I can go anywhere, and I have a society here whose attitude is welcoming and warm, that I'll not experience this disability. So why it happens is because you have an impairment, your environment is not helping you come out of it, and the people's attitude, people around you are not welcoming you to their world. Okay, that's when it becomes a disability. So when I live in this place, what happens is, like, I have my own electric wheelchair which I can ride without anybody's help, and I have people who help me to get into this wheelchair, and I have an environment which has ramps, places wherein I can open and then go on my own. So in fact, on a day-to-day life, in this place, I don't experience any kind of disability. So because people are welcoming, environment is accessible, and I have ways to overcome my impairment. So this is something which we need to keep, which I want all of you to think of, because when we see somebody as disabled, we all have a part in it. We all play a part, a major part, by our attitude and by not making this environment accessible. So this is something which we all should be doing, and we all have a responsibility to do it. So anybody whom you see in a hospital setting or in public world outside or in your home, if they are stuck in their life, we all have a collective responsibility to towards that, and we all cause it. So that I just want all of us to, this is a hard fact, I know it's a very difficult thing to swallow, but I want all of us, we are all in healthcare field, you all want to learn what is palliative care and get more experience in palliative care. So please let us all remember this when we see somebody out. I'm repeating it. We have a responsibility, and we cause this too. If we had a different attitude and we took different actions, this person's life would have been better in some ways. So this is the disability and some facts. So I prepared this some time back. So these are all from WHO documents, some key facts from WHO documents. So they say that there are around 1.3 billion people live with some form of disability. And this is increasing because of the health conditions. And then what they say is like it is 1.3 is around 16% of world's population. They are experiencing significant disability. And they are also predicting that by 2030, it will be 1.4, there will be 1.4 billion people aged 60 or over. And this figure is going to rise in the coming decades. And what does that mean to us is that, okay, as a world, we are all aging people, and then the kind of disability we are going to experience temporarily or permanently is also going to like increase. So we are all only 1 in 9, like 10 people die sudden death. So that means that almost all of us are going to experience some form of a disability, whether it is temporary or permanent at some point in our life. So, and this is because it is coming from WHO that we are talking more about health. So we often experience stigma and discrimination, receive poor quality of services when it comes to healthcare access, because when we go there and then many times your X-ray tables are not accessible to you. The way you are carried and shifted to your scanning or X-ray is so difficult and bad that you don't want to go back to that place again. And many times you are also be abused in these situations and misused in these situations. That also happens. It's not a rare situation. And then what happens is like, okay, we all live in India. So in a country like ours, what happens is like we don't have proper primary healthcare available. Our access to health is very difficult when it comes to, I can always think of this because I come from that kind of a rural place. So what it would have been for me to stay at home and then access healthcare. As I told you, every month, the changing this indwelling catheter every month would have been so much of a torture to me. So that is, there are people living like that still in our country. So I know we see many of those people at home go for home visits and give care at home for those kind of people. So there are a lot of people who are living in that situation. So, and primary health is not so developed, so we don't have access very next to our house. So we have an urgent need to scale up all these facilities and disability inclusion in these levels so that people with disability get some kind of care. And this is a study which says that because when you have a disability, what happens is like you are not able to, if you are a child with a disability, access to education is limited, and then because you are not educated properly, you are not able to get a job, and then all these adds to your poverty, because you don't have enough money, and you maybe when you need a caregiver on a daily basis, your caregiver, whoever it is, your parent or your spouse or whoever it is, they are also not able to go for any work. So that adds to your poverty. And along with that, there is a higher medical expenditure. What happens is like when you have a fever, it is just you can get into a bus, go to a hospital and get your medicine. But when you are a person with disability, if you have a fever, you will have to get an ambulance, get somebody to take you there, and then that adds to the cost. You are not able to access whatever is very next to you. You will have to find more like vehicles to go there, people to carry you and all. So that adds to more expenditure. So this is a study. And then what we see when we go to our patients at home and all, there are many people who are not able to access healthcare when you have a disability. So one example which I always tell people is like my personal experience. So like I had a like toothache sometime back. So you can also, just like I said, like about the fever, like you get a toothache and you have a you had a bad night, and then next day morning you go to the nearest dental clinic, right? You go there. It might be many times. It will be like two floors up or three floors up, and there will be a small clinic very like next to your home or in the nearest town. You go there and you get it extracted or you get it checked by a dentist, and that's it. That is end of your pain, and you can sleep well from next night on. But when I got it, you know what happened? So I had to like ask somebody whom I knew that to find out which dental clinic has got accessibility, which has at least some ramp or a clinic inside a hospital. And then like my colleague, she called so many doctors and then found out that, okay, there is an accessible clinic. And then we arranged a vehicle, and then there were people to carry me in and out of that vehicle, and then taking me to that hospital. So it would have been a nightmare to my mother if I was back home in my village. How does she do all these kind of things? From where she's going to get people to carry me all the way? From where she's going to find which clinic is accepting people with disabilities? Because it is not only about the ramp in front, it is also about how accessible their dental chair is, and if there are people to carry me from my wheelchair and shift me to that dental chair properly. So all these kind of things happen. So what we see very often and very regularly is that accessibility. That is a barrier to access healthcare for people with disabilities. It is very difficult to reach hospitals for people, and dependence on others, of course, because for me, if I want to go to a hospital, I need my mom and I need two other people to come with me. And then who will be available at home? Will my cousins be there? Will my other relatives be there? Or will my neighbors help me? So we need to depend on so many others to go to a hospital. And so finally we decide that, okay, it's okay. I'm able to manage for today. I'll not go for today. So I'll just push it to the next day. And high cost of transport. As I said, I can't get into a public transport and go to any of the hospitals. I'll have to hire a vehicle, and that costs a lot. So high cost of transport and poverty or financial issues, because I already have all these issues and I'm not working, my mom is not working. So I'm already experiencing a poverty. So I don't have enough money to like find a vehicle or to go to hospital, which is not the nearest one, but which is accessible. So these are the common barriers which we see when we care for people with disabilities in our spectrum. And I'm sure that you must have seen some of these pictures. So these are our home visit pictures. So these are the kind of places we, as our team, try to reach to and give care for. So you can imagine how it would have been to live in this kind of a place and then get into a hospital when every time you have a fever or you have a urinary infection. So what we can do, so we are all learning about palliative care, and so what can we do for people with disabilities? What palliative care can do? So what happens is, like, when you get a disability, if you are in a high income country in a developed world, what happens is, like, you go to a rehabilitation center and you get all the rehabilitation which is required, and you come back to your house, which is made accessible for you, and you come back to a place where all these public places are accessible to you. You have your supermarkets are accessible. Any place which is needed by you, it is accessible. So that kind of a situation doesn't exist at all in a country like India. So that itself causes serious health related suffering, because when I have an indwelling catheter, I get repeated urinary infections. And then when there are issues with your skin, you are not able to move from your wheelchair to bed, bed to wheelchair, etc. You are like more prone to skin infections and skin break. So all these things happen, and that causes a lot of health related issues if you are stuck up in a home. So, and this is not Pallium India does. This is every palliative care center, or most of the palliative care centers in Kerala includes people with disabilities into their care spectrum. And then it had been there from the very beginning of palliative care in Kerala. So this is nothing which is unique to Pallium India. It is everybody does this in Kerala, and my wish is that we all do it from wherever you are. So we all do it in all parts of our country. So what we all can do as palliative care providers. So this is something which I believe in. So when we talk about health of a society, it is if we as a society in this room right now listening to all these things, the total health of us is like health of all of us together, right? So what happens is like when you have somebody with a disability in your neighborhood, when you're in your community and in your society, that means that if you care for that person and bring that person also up to doing something, or at least managing his life on his own, the health of that complete community is increasing. So this is something we need to remember. And you can sensitize yourself to the specific issues and challenges of people with disabilities. What do they need? What are the specific challenges they go through, and how you can help? And then this is like, okay, the moment you see somebody with a disability, what happens is like, okay, you take decisions for them, because that is how it is. We all do that. We ask our caregivers. If my mom is pushing my wheelchair, all the questions, what is her name? If at all they are asking about name, that is to my mom. And then what happened to her? All those conversations are to like my caregiver, or who is coming next, and not to me. And in the hospital setting, it is, of course, always it is. And while I had been in hospital for 4 years before I came to Pallium India, it happened only when very rarely that doctor spoke only English, and then my mom could not speak, or my sister could not speak English. That was the time. Maybe it was more like acting like a translator. So even then the questions will be directed to them, decisions will come from them, but I'll be kind of translating, but at least I'm talked to at that point of time. Apart from that, I think most of the time it was all talking to caregivers about me, talking to bystanders, not even caregivers, about me, and people never talk to me. So this is something which we need to remember always as a palliative care provider, because disability doesn't mean an inability to decision making. I can think just like that Ashla. I'm the Ashla who lived before also, though I cannot walk right now. So I can think, and I have my own decisions. And many times, sometimes if I'm not able to take a decision because I don't have access to information, or I don't understand this medical situation properly, you have a responsibility to explain to me that, okay, this is what it is, this is how it is, this is the prognosis. So, and then help me take a decision instead of taking decisions on my behalf. This is something which we all can do as palliative care provider. And okay, so, and most importantly, I just wanted to say this because we have already seen this WHO fact sheet, which says that at some point of time, we all are going to live with disability, maybe temporarily or permanently for some point of time. That is there, but leave that aside. It is, we all live in a society together. This is a society where I live also. So it is not about, okay, always, okay, people with disabilities at one side and then people without disabilities or able-bodied people at one side. It is, this society is about all of us together. It is never like them and you, it is us. So it is not because you will experience it at some point of time, but because we all live together in this as a society. So, and we all have a responsibility to support each other in whatever situation it is. So this is about what we can do. And I would like to use this opportunity to tell you about some etiquettes which we can follow when you meet some people with disabilities. I like to talk about this only because we never get an opportunity in our society to learn about these kind of things. We don't learn anything about disability in our school curriculum. We are not allowed to go and play with people. We stare at them, but then when I see that a lot, when children, they're so curious and they are so happy, then they see like they don't see me so different, but then looking at my wheelchair, looking at the way I ride and all, they want to come and talk to me, but then parents will be like, okay, no, 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 don't go, don't go. So that tells them something is different, but then it is not the fault of that parent because she or he was never taught about how to deal with this kind of situations. So that is why I thought we will also talk about some disability etiquette when we have this discussion. So one of this is like we all do this sometimes. So like everyone needs assistance. This happens to me a lot, many times. What happens is like I go in my electric wheelchair, so I cannot push a manual wheelchair, but I am on my own with my electric wheelchair. So when I use this wheelchair, people want to help, so they don't know what to do to help me, so they try to push. So my wheelchair weighs around 40-45 kg and I'll be easily 65 kg. So altogether it's more than 100 kg, but they still want to push that wheelchair and help me. So, and then all, like, I don't want to offend anybody, but all I think of is like, okay, people, please don't do this. I don't need this help, but I need help to open the door in front of me because I can't open that on my own. Or I want your help to fill my water bottle because I can't do it on my own. I want your help to switch that light or fan on because I cannot do that on my own. So I'm not saying that I don't need any help. I'm only saying that I have many different things where I need help with. So please don't assume that I need help with pushing my wheelchair. That's not the kind of help I need. So before you decide somebody to help somebody with whatever you think that they need, please say hello and please ask them, okay, how can I help you? Or just say that what, you know what, when I go for any public meetings and all, when there are so many people, if somebody comes and say that, okay, I'm here, if you need any help, please tell me. So that in itself gives me a lot of confidence that, okay, oh, I can go and ask this person if I need. I may not need anything at that point of time, but maybe that gives me a lot of confidence in that group of people. So that is one thing which you can do. Please don't assume, but just ask people what they need and then do accordingly if at all possible. And then, okay, people come and ask me many times, like, or they don't even like call me or treat me as a person. They just ask me, okay, what happened to you? Oh, accident. Okay, when did it happen? You can't walk at all. You use this wheelchair. You can't even stand. Did you try that Ayurvedic doctor? This doctor is so specialized in this. I've known people going to him and walking again. Why don't you try? And all these things happen. And is this the way you talk to somebody when you meet that person for the first time? No, you ask, okay, what is your name? From where are you coming? And from like, what do you do? What are your likes? Those kind of, and we also talk about the weather. Oh, it's so hot today. You can tell that to me also. When is it going to rain? These are the kind of things which is like meaningful or meaningless. We all make for conversations. But then when you see somebody with a disability, everything changes. You don't know, you are clueless about what to talk. So treat me as a person, and then talk to me as you would talk to anybody else. And the next is, okay, yeah, always treat an adult as an adult. Just because I use a wheelchair, that doesn't mean that you have to like speak to me like you speak to a child. That happens many times. I have experienced it many times. So if you see somebody sitting on a wheelchair as is an adult, talk to them as an adult, and then you will find out, okay, to what level you can speak, to what extent you can have a conversation. Doesn't mean that you have to have an extended conversation with everybody you meet, but sometimes you like you talk to somebody and then you get interested in, that's how we make friends, right? So that's what you can do with somebody with a disability also, whatever kind of disability it is. And okay, I talk mainly about people on wheelchair because that's what my living experience is. And this is something which you should remember always. You can always ask questions to the wheelchair user, whoever is sitting on a wheelchair. And then if at all it is not possible for that person to answer, there will be somebody like if I cannot answer that kind of a question, whoever is with me will do that. But then ask me directly. So it is so rude to ignore somebody on a wheelchair and simply talk to the whoever is accompanying. And I have had like many experiences in this, but something which I always remember is like when I just went out in front of our hospital road for a walk. I love my walks, and then it's only very rarely that I get a chance to go out. So I just went with a friend, and there was an elderly lady who was like standing near the gate of her house, and she was asking that person who was coming with me, like, is she mentally retarded? So what happens is like the moment, like, I'm not saying there is something wrong with being intellectually disabled. There is nothing. What I'm saying is we often associate disabilities together. The moment you see somebody on a wheelchair, you think that this person cannot read or write or talk or do whatever it is. So, and then all the questions go to that person, and then he said, okay, finally he said, why don't you ask this person directly? So then she was like, okay, she didn't know how to respond, and then she started asking me for something. And I also had another experience when I went to a hotel with like some of my friends and colleagues. So the menu card was given to everybody except me. And then this person came and waiter came and asked for my order. And then I smiled and said, you didn't give me a menu card, so why, how are you expecting me to order? So, and then he like apologized on that day, but I'm not saying about that one single person, because it's quite natural when you see somebody on a wheelchair, you think that, okay, this person cannot read or understand or make their own orders for themselves. So these are things which we do unconsciously because we are never used to like being with people with disabilities. So it's not our fault, but this is how things have been. So, and this is also something which you can remember. Sometimes this is a very personal space. Maybe you can ask me whenever I say that, okay, I want to move my wheelchair. Okay, then you can touch it. But it's better to keep it as a, okay, this is my own personal space, and you shouldn't be touching or moving it without permission. And then this can be moving a manual wheelchair without permission can be like risky also. You know what happens that we have that rim for that manual wheelchair where you can hold it and push it. And many times it happened to me also once while I was using my manual wheelchair, that my finger was inside that, and somebody who actually wanted to help me push my wheelchair, and luckily I could get my thumb out of that rim at that point of time. But otherwise, if it had gone in, it can hurt you. So that can also happen. And then many times, even if you see somebody like sitting so confidently on a wheelchair, the kind of a body balance that person has, you don't know how much it is. So at that point of time, if you push without a warning, that person can fall down also. So there are like actual risk also. It is not just about an etiquette, but there are actual risk if you simply push a wheelchair without any warning to that person. I think, yeah, this I already mentioned that, okay, you can talk to me as you speak to anybody else in that kind of a group. So this is something. Okay, yeah, this is if at all possible. It is also because it is not, so many times it is not very easy to just look up to somebody. You say up there and then I'm so down here and then talk. That power imbalance is always there. Not only because of that, but it strains my head many times. So for people who don't have so much of a balance and muscle strength, it's actually very difficult to talk to people when they are standing next to you and talking. So if at all possible, please pull a chair and sit next and talk. So we are at the end of this. So can I have a volunteer to read this? Anybody who can unmute and read this for me?
Can I?
Yeah, sure. Thank you.
People ask me how best they should describe me, differently abled, Divyang, Jan, or disabled. My response is call me Ashla. If you insist on an adjective, I prefer disabled. I am disabled not because I use a wheelchair. I am disabled because I cannot access the outside world. I am disabled because buildings around me are built without access for me. Because the pavements, public offices, restaurants, and ATMs are not wheelchair accessible. I am disabled because you cannot think of me as a contributing citizen of the country. Calling me differently abled or specially abled or Divyangjan does not change anything. Make the environment accessible, your attitude open and welcoming. I shall stop being disabled. Then I will be just Ashla, another human being like you.
Thank you, Chami. So that is the end of my presentation. So we have 30 minutes or at least 25 minutes. So I'm open to any question you have. We don't have a
You-
I have a que- I have a question, madam.
Okay, tell me, Ravikant.
So how can we? Many people are kind of because they go through certain disabled state, maybe transitory or is it permanent? It depends. So how can we? A kind of motivation we can give as a therapeutic intervention in their lives.
So what we try to do here is like, or at least when we talk to people, give something which is realistic to achieve. Because for me, that this comes from my personal experience, because
Okay.
whatever like motivated me or encouraged me to do something was like, okay, I could do something and I could achieve it. So
Mm.
that if people just ask me, okay, get up and walk, that is like I try it, but many times it is not possible. But then when we, okay, what is so important to you? So, okay, getting my signature right, getting my checks right, or using my laptop. Okay, let's focus on that. Okay, what do we do now? So, divide it into smaller chunks and then ask them to do things which are achievable. So that means that, okay, you achieve something, you get a satisfaction out of it. So you are motivated to try more. So always as a healthcare provider, when you work with people, and then I think this is the easiest and simplest way to look at things.
Okay. And also the don'ts, especially because when we counsel a disabled person, don'ts.
Yes, that is, and I just mentioned these small points because if you really have an interest in this, you can just Google and find more and more about it, read about it to understand that. So you can sensitize yourself. That's why I said you sensitize yourself about it. You read wherever it is possible to understand what you can do. And at a personal level, what I always find is like when you treat somebody as a person, like I see that difference. You are interested in Ashla and Ashla's issues, then that actually gives me confidence to open to you and tell you things. These are my
Okay.
issues. This is how it is, because we can always sense that somehow, whether you
Mm.
are whether you are treating me as a disabled or whether you are treating me as a person, that can be, whether you are looking down on me because I'm disabled, that we can sense it, that everybody can sense it, right? So I think the key is to treat that person as a person and then tell them clearly. If you tell me that, okay, if I make some mistake, I want to do this right. If I make some mistake, please tell me, because I don't know this. I never got a chance to learn this, or we never get a chance, you know that. So please help me, or please correct me. So that way people tell you, and then I understand that, okay, you really want to do it. So I don't mind when you make some mistakes, but then I say, I gently correct it. Okay, this is how I would love this to be.
Okay. Okay. Thank you.
Thank you.
Such insightful
Thank
information.
you.
Ashla,
Hi,
this is,
Sonalinima. I didn't know you were
sorry.
here.
Sorry, my voice is gone, but I just have, how are you? I just want to ask you one question. Do you find that children, young children, are in a sense more natural or more sensitive than adults? Or I'm just curious, because with kids, I don't think they have the preconceived notions that we bring. What has your experience been?
I completely agree, ma'am, on that, because like I have experienced it many times when I go in my electric wheelchair. So they walk with me, they walk next to me and then look at, okay, what do I do? How do I operate my joystick? And then what do I do is like, I just stop and then I ask them, do you want to try? Then I tell them, okay, this is the power on, this is the speed, this is how the joystick, and you have to be careful, because if you go so fast, I'll fall down. So let's keep the minimum leg speed, and then they actually try it out. So that way we make friends, and then it's actually very easy to, and then they see it, and when they see another person on a wheelchair, for them it's actually the different kind of mode of transport. That's it. They don't look at them as some aliens as adults do, because we all talk similar language and we smile and we make friends, and they at that point of time they know that, okay, this is also just like my auntie, my chitti, or whoever is at home, the same way they talk, the same way they interact. So that's quite very easy to like talk to and interact with children.
Lovely, thank you.
Okay, thank you. There is a hand up. Sucharita.
Yes, ma'am. Yes, ma'am. I'm a clinical psychologist working in a cancer department. And thank you so much, ma'am, for your wonderful presentation and your inspiring story. Ma'am, I had a case. She was 35 years old and diagnosed with glioblastoma GBM, WHO grade 4, and underwent surgery twice. And then post surgery, she was under chemotherapy. And gradually, she was losing all her abilities like walking, talk, speech, and she was completely dependent on her husband. Even she couldn't even she couldn't have control over her bowel movement and urinary system and all. But whenever I uh, faced that person, when I wanted to interact with that person, to connect with that person, I could feel that she was there. She couldn't reciprocate, she couldn't um, reply me back, but she could receive me. I didn't know how to approach that person, and in that situation, what to do, how to approach, how to connect to that patient and the caregiver. This is my question, ma'am.
She couldn't communicate at all.
No, ma'am.
Oh.
She lost her speech. She lost her speech. She couldn't even turn in a bed.
Okay.
Everything is completely on dependent on her husband.
I think I don't know. I have no idea. But because some person when they are not like communicating back, I don't know. I'm not a medical background person at all. I have no medical background at all. So I don't know how do we do that kind of communication. Maybe we need some speech therapist who understands better and who can like facilitate the kind of communication and that kind of thing. If she can see, if she can make some kind of a movement so that to communicate the need. So yeah, there is a question from Geeta ma'am that can that person write? Yeah, if they can
No, ma'am.
write. Yeah.
She
So
doesn't have all these abilities, and she lost all her abilities due to her disease. So I was very helpless that time that I couldn't connect with that person. But
okay,
still,
yeah, that person. But one thing you can do is to at least support the caregiver, the husband.
yes.
And as I mentioned, the one person which we never see is the person who is standing next, bystander who has no name, no identity, and who is expected to do everything. You are all in like from a healthcare or medical field, when a nurse explains that, okay, turn this side every 2 hours, turn that side, do this, dress like this, or you can do sponge bath like this. This is something which you learned for 4 years professionally, and you are doing it in a like daily basis routinely. So you are an expert in this, you are a professional. And my mom, who was like poor mom who was there lived all her life in that village with her own plants and trees and whatever it is, and she's coming to this very big medical college hospital with lot of people and patients one day, and next day she's told that, okay, you do this, this is how you do hair wash, this is how you do skincare, and be careful, there is a risk of skin issues when people can't move. And how are you expecting this person to learn all these things in like in 5 minutes? So that is something which we never think of, and something which we all need to be so cautious about. When you treat them as persons first of all, and acknowledge that they're suffering, because at night I may not be sleeping. I might be calling her 5 times at night for water. She'll have to get up and give me that, and then I'll sleep nicely at during the daytime, and she'll have all these daytime work to do. So with all that, you are expecting her to be so healthy and physically and emotionally, and to provide everything which I need. That is too much to expect from any person, any caregiver for that matter. So one thing we all should be doing is to acknowledge that, okay, they do a good work, appreciate when they do a good work, and tell them that, okay, it's okay to make mistakes. And if you don't understand, please don't mind asking me. I'm there to support you, because this is not an easy task to do when it is like chronic long term. It's not like you have a fever and you go with your like sister, and then you stay for 2 weeks, get your injections and everything, and you come back. It's not like that. It's a long term thing, and it takes a lot of effort. And one thing which we don't see is like in young couples who meet with accident and come here and all, they may not have had a good relationship to start with in the first place. The moment husband gets into an accident, you expect the wife to be the most devoted person to care for this person, do everything. What about this husband was an abusive person who was beating her every night, and this moment on, you are expected to do everything? Are you thinking that this is going to happen? So a way to, and this comes as a responsibility to this person. At least in our society and our culture, men have a choice to leave this person and go. Many times we see that also. But women, they are stuck. They don't even have a choice to leave this person. And even when somebody is ready to stay and care for, it's not an easy thing. Already existing. So these are things which we can explore, we can help, and this caregiver, we can tell them, if you are not feeling so emotionally connected to this person and caring for, it's okay, we understand. So at least there is somebody to understand and talk about these kind of issues.
Thank you. Thank you so much.
Next. Any other questions we have?
Ashla, what was your experience with our halfway home? That is a new beginning. That was a new beginning.
Yes, that it is. We cannot call it a perfect rehabilitation center at any point, sir. But what happens is like there are many people who cannot. Our facilities for rehabilitation and the availability of rehabilitation centers are very limited, and the way people can access it and afford to go there are also minimum. So the way we care for these people, at least to make some thing out of their life, that is where it comes in. I'll not compare it with any the perfect rehabilitation, physical medicine and rehabilitation centers, but what we are trying to do is at least to the minimum, we make them independent. Wherever it is possible, we make them independent on wheelchair, bed to wheelchair movement, wheelchair to bed movement, get them to take bath on their own, dress on their own, so that these things which give them some kind of an independence. And we also try to modify their homes. What happens is like, okay, whatever they learned from here, we go. So I see a lot of people getting benefited out of that. There are people who are like trying to do some work and then get some earnings, support their house income and all those kind of things. There are good things happening out of that, but I don't say that, okay, we have done 100% or we are doing 100%. We should always try to improve on what we are doing, and there is more to do at any point of time, sir. Okay, any other questions? Maybe we can take one or two. Geeta ma'am, I would really love to hear from you something. Because I've been seeing you smiling and nodding and all, so something. At least tell me a hi.
Yeah, first I say hi, and I just want to say I really admire you. Very vibrant smile in spite of what you've been through. And that time she saw me nodding and smiling because I could identify a lot with what you were saying, because I was in the hospital myself for 6 months. I think you're frozen.
No, your voice is clear, but your video is frozen. We can hear you. I think all of us can hear, right?
Yes, ma'am. We can hear you.
Yeah,
Can you-
it's perfect now.
Yeah, I could identify a lot with you when you share. That's why I was nodding. I was in the hospital myself for 6 months. I was on a ventilator, and like you said, people just didn't address me. I didn't exist. I was patient number so and so, bed number 6. And oh, she can't talk. That means they assumed that I didn't understand. I was finally they had to do a tracheotomy, so I couldn't speak at all. That's why I was asking if you could write. I would write to my daughter or my husband and give out the messages. And it resonated with me because when you are disabled, we don't see that person at all. And secondly, the caregiver also, whether it's your daughter or husband, like in your state, your mother, they need as much care as we needed. They don't get the rest, like you said, they don't get the attention, and they're just expected to do. Like the doctors would come and tell my daughter, oh, call your father. I don't think she's going to make it. I don't think this. And then my son couldn't handle it, so she could handle. My son, I wanted to say in the beginning when I put my hand up, suffers from cerebral palsy. So he has luckily his brain was not affected. He's disabled. So when he was a kid, the parents would look at him and then come up on what is wrong with him? What happened to him? And even when he was an adult, like now he's 32. And thank God he's doing very well. He's working at a good job. But the point that I'm making here is the disabled person is completely ignored. Whether you're in bed, whether you're handicapped, whether my father-in-law was blind. So when I used to take him for a walk in the evening, people would not talk to him. And then he would say, who's that? Who's that? So I would say, talk to him, he can hear. He's blind, but he can hear. So that's why I was nodding and smiling a lot, because it brought back a lot of memories for me and still does.
Thank you.
So, yeah. Thank you for your beautiful sharing.
Thank you.
Thank
you. Anybody else? Any other question? Maybe we can take one more if there is. Anybody maybe who want to give a comment or share an experience? Anything?
Madam, one more doubt actually.
Ah.
You told that always treat the adult as an adult. But unfortunately, you are a child in front of my view, in my thoughts. What can I do?
No, sir. Like, see what I was saying as that, because when you meet, like, see, for the first time you met, you all had the training and you asked me, okay, what is your name? From where are you coming? What are you doing? All those things. Okay. I was telling all this about, and then we developed that. And for me, you are an uncle. Okay, I call you uncle, I call you sir also, but I call you uncle also. And we speak that way. And that is exactly what I was telling. When you meet a stranger, you meet at their level, right? And after that, you get to know, and then from there you make friends. And from there you make relationships also. Like, okay, some people are like even for me, there are like my chechis or aunts or uncles. So there are people like that. So that we do after. So, but the first thing I was telling is when you meet one person as a stranger, that's all. And after that is what happened, no? When you all, if you were all coming in as a physical course to Pallium India, the first day when you meet, you talk to each other like, okay, what is your name? From where are you coming? What are you doing? Like, why are you interested in this course? What brings you here? What do you like about Trivandrum? How is this weather? Is it so hot for you? These are the common things. And then from these, like, see, we have around like 68 people here. And then some people become friends very soon. Some people will take some time. And after maybe a week or so, you will start talking about, okay, I have these issues at home, or this is how my life is, and this is what my interests are. You get to know each other. And then that's how you build it, right? That's all I'm talking about. Because many times in public, when you meet somebody in a wheelchair, either you are ignored or you are asked, like talk to like a child, or you are asked all these unfortunate and rude questions like, okay, what happened to you? And you know what? I have even had people asking, okay, oh, so how do you take bath and get dressed up? Then what kind of an insensible question that is? Do you ask anybody when you meet? And this is a person who I met for the first time. So they look at me and they see that, okay, I'm dressed up so nicely and I'm sitting and I'm talking. So all these are happening, but they are so vulgarly curious that they want to know these kind of things. So these are the kind of dawns I talk about. The moment we make friends and we know each other, and the way we talk, the way we tease, the way we have our conversation, that is so different, sir. For I know for you who I'll be, and I want to be that kind of a person to you always. So, any other questions? If not, maybe over to you, Shilpa and Senior. So before that, I just wanted to say thank you to all of you. Thank you for listening to me. Thank you for asking all those questions. So thank you so much.
Yeah, thank you, ma'am, for your valuable inputs, like sharing your own experience with the participants. And I hope all doubts are being cleared regarding this topic. And I hope I also understood that you all know how Pallium India or how palliative care is being connected with the people with disability. And thank you all. Thank you once again.
Thank you, Ashla ma'am, for that wonderful presentation. Thank you all for joining us. This is such an important topic in palliative care too. Thank you all for joining and for your valuable time. The feedback link will be shared in your WhatsApp group. Thank you all and bye.